Beyond Clean continues its COVID-19 Impact Update series, and I'm very excited to speak with good friend Larry Muscarella. Larry, you've been on the show before, but this is kind of your wheelhouse. A lot of the conversations that have been had around COVID-19, especially for our audience, is specifically about the risk to the frontline healthcare personnel, especially those involved in reprocessing. So I'm excited to have you for this update today.
Yes, good morning.
So let's talk about the impact, because your world is very much centered around flexible scopes. We haven't heard a lot about protecting endoscope reprocessing techs from exposure to COVID-19, but instead of sterilizing, in many cases, we're doing high-level disinfection. The techs are also working with intubation scopes and devices that are going to be used on patients with COVID. So what should these frontline technicians be concerned about protecting themselves from becoming potentially infected as they reprocess these devices?
A couple things. When an instrument needs to be cleaned and disinfected or sterilized, the first question to ask is, could that instrument be contaminated with COVID-19? And for many types of instruments, the answer would be yes. We can assume almost a worst case paradigm where we assume, kind of as we did years ago with HIV, we assumed all patients were potentially contaminated, and so we adopted standard precautions. And I think in these times, it's wisest probably to assume that any contaminated instrument, whether it's an intubation stylet, a respiratory therapy device, whether it's a gastrointestinal endoscope, has the potential to be contaminated. So we want to address that to rid that device of that contamination so it's not transmitted from patient to patient. But we also want to protect the cleaning tech and central supply personnel to assure that when they're handling the instrument, they're not being exposed to the COVID-19. The instruments that are going to be a particular concern are those that might have respiratory droplets or viral particles on them from the respiratory tract. So those types of instruments that are being cleaned should send an alarm that they are potentially contaminated. And therefore, when we clean them, we want to assure that the technician is protected with personal protective equipment. You've heard that word a lot, of that acronym, PPE. We want to assure that the staff are wearing gowns, gloves, and face masks. Face shields also are ideal. We're in a situation where our supply is very, very limited, so at the very least, technicians should be wearing a surgical mask or medical mask. If a N95 respirator is available or another type of steering face piece, this is ideal because during the cleaning process, aerosols can be produced. So, for example, when we're cleaning an endoscope, it might be ideal to assure the endoscope stays under the fluid level, whether it's the disinfectant or the detergent, so that any aerosols that might be produced from a contaminated instrument, that is an instrument specifically contaminated with COVID-19, that's not aerosolized into the air for a technician to inhale. If you have an N95 respirator on, that's not as big of a deal. But if you have just a surgical mask on, it would be. So we want to dot our I's in terms of what we're wearing. We want to dot our I's in terms of understanding the instrumentation that we're cleaning and its potential for being contaminated with COVID. Is it high risk or low risk? And then we want to clean it in ways that minimize the aerosolization so that we are protecting ourselves as well as protecting that instrument from propagating that disease and passing it downstream from one patient to the next.
Yeah, that's a really good point, Larry. But you're talking also about how they can prevent themselves from inadvertently contaminating patient-ready endoscopes with the virus as well as they're going through the reprocessing process. And so here's the big takeaway, right? Standard precautions hasn't changed.
That's correct. And for certain high-risk instruments, we almost want to adopt a droplet or an airborne precaution paradigm because the transmission can occur two ways. We can have a contaminated instrument that can then produce aerosols during the cleaning process that could contaminate the cleaning tech, or the other direction would be a member of the staff who themselves are contaminated with COVID and then contaminate the patient-ready instrument through a cough, for example. So we want to create a barrier to prevent the disease from being transmitted either of those two directions, from the tech to the instrument or the patient, and from the patient and the instrument back to the cleaning tech. It's bidirectional. The transmission can occur either way. And we use standard precautions, and we use surgical masks and N95 respirators or other types of filtering face pieces to create that barrier so that that disease cannot be transmitted either of those two directions.
Well, Larry, you do great consulting work, and if anybody needs any help as they are evaluating these situations, I know they can reach out to you directly. I really appreciate you coming on and sharing your insights today.
My pleasure. Please stay safe and stay well.